FamilyLinQ. I'm also going to take you down the hall, down to where we see families, and show you deep listening in action with our partners at FamilyLinQ. This is our main hub area where the families come through. The school is off to the right through the door there. So our little jarjums come in the door straight through, and they're greeted with these warm, friendly people, beautiful artwork and co-designed areas. So this is where lots of families connect before and after school and can sit and just have informal chats with us, with the health team, with the other service providers here. I'm going to take you through to the heart of Kingston, FamilyLinQ, where we just make food together and yarn with our families. We also have community pantry out of this area. So we have food donated to FamilyLinQ, and families come and can pick a range of healthy and fresh, nutritious food. That's on a Monday afternoon. So often what I do there is I meet families. I also welcome them and tell them to come down and do a warm handover to support. It's just another friendly way we can connect with families. Taking you into our clinical, not so clinical space where we see our families. So this is all resources and areas that we can share with our partners. We're being part of a partnership with FamilyLinQ and other Metro South health providers here. So that can look like maybe me outside having a yarn with mum, talking about some supports that might be helpful for her outside of little ears. And then the clinicians might be working in this space with the children, trying to support them with their emotional and social well-being. And it's just a beautiful, culturally safe and fun place where we can work, thanks to our partnerships. This is all places and resources that we wouldn't have if it wasn't for our partnerships. So this is really lucky to be a part of this Kingston FamilyLinQ crew here. Michelle has popped in here today, and Michelle is from the new FamilyLinQ site at Corymbia State School. And what we've done is just had a bit of a yarn together to work on how we do referrals out at Corymbia. So we use this time to sit down and talk through a potential referral.
Being a new to Corymbia service in Head to Health Kids, the challenges that the family are facing, whether this is an appropriate referral for Head to Health Kids, and then what are the next steps in the process to make that referral happen, and to be able to talk that through with Jess. So we'll be able to now do a referral together with the family in attendance, giving them agency over the supports for their family. And they will be one of the first Head to Health families to be seen at our Corymbia hub.
And Michelle's been a really big, important part of helping here at FamilyLinQ too. So this is what we can do when we work together. We've got access to lived experience, so I can meet mum, I can see what's helpful for her. We'll have our psychologist out on site as well, who'll be the clinician at the team. And that's what we can do when we bring all this richness together, is meeting families where they're at. Hopefully we can tee it up with mum for drop off after school, or, you know, something like that. And then they're just making healthcare easier for people and using what supports we have to work together and work collaboratively and hopefully have better outcomes for our families.
But to use your experience and your knowledge about the Head to Health Kids program, being that it's a new service to us at Corymbia, and we work with quite a few different service providers, and each referral pathway is slightly different, to have help to guide us through those referral pathways in a really nice setting like this.
And I think part of that as well is really helpful, is because if we have conversations like this and we're working together, because I sit in intake and referral processes and care review processes, I hear parts of the families and the needs, and I can use my voice and our relationship and us knowing each other and what services we are providing for this family to help advocate within those systems as well. I remember the discussion where we had, and it's not just on a piece of paper, it's you know, these real discussions, and helps me to understand the families better. And then when we're sitting in those processes, it helps us to be able to advocate and add your experience of what the family needs in that space too.
And that help to navigate offerings for family to best support them is really helpful. And we're already at 700 plus enrolments. And we've had this really unique opportunity at Corymbia School to get to know community in a way that's not been a health focus or an employment focus, or we've got to know our families in a holistic way. And so with that, we've been able to identify some themes that are emerging from many of our families, and that allows us to then tailor supports that are the most needed with our families.
So we'll be able to ask families what they need and hopefully be able to develop some groups and see and just really do that co-design together.
We don't have a lot of public transport infrastructure. Many of our families don't drive, and our school environment is a place that families feel safe and welcome and comfortable. And so we're definitely identifying a lot of needs for things to be delivered on site. A lot of our families struggle to access services outside of our small community. So having our services on site is a huge benefit.
Yeah, in reach, coming in to where families are at and where they
absolutely.
need it. Reducing those barriers of public transport, cost of living at the moment and just making
starting groups where there's already trust. Starting groups in a place where there's already a sense of safe and comfort.
Brodie is new to the FamilyLinQ team here at Kingston, and her role is a First Nations community connector. What does deep listening to you mean in your role?
So with the role, I think deep listening, it's something that we practice, but it's also being able to sit with them and not just hear the words that our families are telling them, but be able to notice their reactions, how their facial expressions are, feeling it as well as hearing the words. So listening, not just on the listening scale, but going to that more spiritual bit, being able to connect to them a bit more than just what they're used to.
I love that. I think it's very similar with lived experience. It's the magic that you feel when you're really making that deep connection, and it takes time to meet families where they're at. And sometimes, like in my role working with FamilyLinQ and other communities, it's sometimes sitting on the floor, just having a yarn and just being present and capturing that experience from the family. And that way we're really getting to know what they need in an area that they're feeling comfortable with in their own community as well. I notice you get that much more richness as well.
I know I've gone to one of our families before to ask them a specific question, but not wanting to interrupt where they're at in their conversation. I've joined in. An hour and a half later, I've asked my question, but I've also found out a lot of things that they didn't even know were potentially something they needed help with. Being able to listen and hear what they're saying, but also understand that there might be more to it, and getting them to open up about that.
And it's such an important role you do here, Cody. Do you find that having the cultural understanding of the community is helpful for connecting with families?
I think it's definitely more helpful. So I think all of our connectors have that. We all come from different cultural backgrounds, and we're all able to make that connection on a different level. I think having my connections to the Logan community already has been very helpful, because I can just have a yarn with a person and just act like a normal person, and I was given those skills to be able to have those yarns without them feeling awful. And I feel like I've gotten that from our First Nation community on the outside, because you run into them outside, and it's the same that I wanted to bring here, and that's what I feel like our other connectors on air and Megan all that bring as well from their cultures.
It's all what we bring. It's the warmth, it's the relational care. There's something so therapeutic in meeting families where they're at, very similar in lived experience roles, where we're often sharing vulnerabilities and real life challenges with people to help them feel less stigma, to be able to connect in different ways. And I think coming in as a service provider, people starting to notice my face in here and noticing that I'm a bit of part of the furniture. So then I'm sitting out there helping with community pantry or eating my lunch, and then all of a sudden someone's sitting next to me saying, experience role, and we start chatting, and then I'm like, okay, putting that connection to offering some support for their kids, and that's the beauty of just being present, but also breaking down those barriers and doing deep listening where people are at, and not having to book into an appointment, or just being present in the space. It creates a sense of, you're a familiar face, you're okay to trust, and I can approach you with something that I need. And I think that's the magic of what happens when we all come together to support each other.
We have a family who utilises the space to connect together, 3 siblings and their mother, and they all come in almost daily, if not weekly, just to eat together, and just to have that time to touch base, get together before the kids are all, and they're able to use this space just to be together.
To other cultures and building on things that, like, you're creating that sense of safety here, but then by bringing in Metro South Health and Children's Health and other community providers, there's all of a sudden a whole array of different services that are available for families.
And so they knew me by name, and they were excited to come in to the point that we were running straight from school in here, and we're started coming in more regularly, because we were able to connect them not only to their culture but to more people from their mob. They might,
which just builds trust and safety around them.
and then we have our mob program, so our First Nation program, Ganyameta comes in and they just play games with the kids. So it's an initiative to keep our kids active and their bodies moving, especially for our First Nations who have more health risks.
There's a space for the clinical supports, and we know that, but communities need real life access to things that they can do when services step out, and groups like that, like cooking, cultural connections, social groups. This is the future of healthcare, because it's sustainable for families in community when we step out.
And the unfortunate thing is a lot of our families don't know that the services even exist.
So it's a connecting point too, isn't it?
So, and that's why we're us community connectors. We try to get out and get them to connect to different people, like Village Connect there for our Pacific Island. But it's just a lot of people don't understand and they don't know about it.
Or need someone to hold their hand and just do it with them.
Just sometimes, especially if you've tried to be with those services before, it's sometimes very hard to take that first step back into it. So being able to be that person to help them take that first step, it's been great.
FamilyLinQ came to be. It's a lot of the groundwork, I think, was laid by Logan Together through much of their community engagement, community research. What does the community want and need in Logan? And a lot of what came back from community members was they want hubs, they want places they can go where they can access a range of opportunities. So whether it's services, programs, activities to support them, to support their children, to support their wider network of friends, etc. So there, as you know, there's been different hubs around Logan for a long time, and that was part of the feedback, is that these are working well, stretched, and we need more of them. Maternity hubs were born out of a lot of that engagement and feedback. So we've seen those being established in Logan over the last number of years. So this was the next evolution of those, and we've seen school-based hubs have grown around Australia and internationally for a number of years, and in Victoria they've been happening for over a decade. It was certainly to meet a local need, to drive change and to provide families with opportunities that just weren't available in the city at the time.
Responding to the need,
Yep.
and listening to the families. This is coming into this area and in the child health. I really reflect a lot on when you're mentioning about how Logan Together was part of how FamilyLinQ came about, because we're also intertwined in Logan, and a lot of our services, we're getting information through about Brain Builders and Logan Together and all the programs. And so part of us working in this model, we've got partners in our program who are speech pathologists sitting on advisory boards, and then they're sharing that information to us. And it seems like it's that sort of connection that we keep going in practice. FamilyLinQ providing the hub, Head to Health Kids coming into work, supporting families, working together and sharing resources. And sometimes it's a really hard, there's so much information out there, but when we're all coming together and being able to learn together and be a part of that in practice and in different ways, that's where real partnerships can happen, and we can reach further in that space too.
Absolutely. Our bureaucracies and our systems are set up, not particularly set up around the family. So they do an amazing job at delivering services. Another thing altogether. So what we're trying to do in this initiative is bring families to the centre, and services and programs and activities, supports around the family.
Coming to the family.
And recognising where the family is at, and provide, and that takes integration, and that takes systems working together, people from those systems, from different systems working together to recognise what are the aspirations to support that family, and not the other way around. How does that family work to get all the services that they need?
And trying to identify the gaps, and if we can't meet that need, who can? How do we connect you with who can? How do we use our networks and our partnerships to work together to support you in a way that your family needs it?
There's much work to do in terms of integration and building partnerships. So we're all on this journey together, and it will be 5 and 10 years and 15 years, I think, until we're really seeing how this whole work fits together, and how government and community organisations and community members can work together around the school, and using that platform as a platform of school to just get better outcomes for families.
Doing really great work. Thank you, Luke.
Thanks, Jeff.